Hey, good morning, everyone. Lower urinary tracts, or LUTS, are incredibly common in men, and they can significantly impact quality of life. But here's the big question. What if these symptoms are not caused by an enlarged prostate? We're looking at a new systematic review exploring whether phosphodiesterase type 5 inhibitors, commonly known as PDE5 inhibitors, can help manage LUTS in men without benign prostatic hyperplasia. So let's start with the background. What is LUTS? LUTS can include these symptoms: urgency, frequency, weak stream, nocturia. And while these symptoms are often linked to BPH, that's not always the case. Men can experience LUTS from other causes like an overactive bladder, post-prostate procedures, ureteral stents. Now, PDE5 inhibitors, yes, those tadalafil, sildenafil, the ones that we use to treat for erectile dysfunction, are already well established in treating LUTS associated with BPH. But their role in non-BPH cases, that's been less clear until today. Well, I can't take credit for it, but until I reported on it. This systematic review analyzed data from 4 major databases, including PubWeb, Web of Science, ScienceDirect, and EBSCO. Out of 341 studies, only 5 clinical trials met the strict inclusion criteria. These studies focused on men with LUTS from non-BPH causes, including post-brachytherapy patients, overactive bladder patients, double J ureteral stents. Boy, those patients complain a lot of that. Let's talk results, because this is where things get interesting. So here's the key findings. Across the studies, PDE5 inhibitors showed improvement in urinary symptoms, reduction in the IPSS scores, the International Prostate Symptom Scores, better storage and voiding function, and improved sexual function. The last one's probably not a surprise. And importantly, they also help reduce pain in certain patient groups. These are turning out to be miracle pills, folks. Among all medications studied, tadalafil showed the most consistent benefit, not just for urinary symptoms, but also for sexual health and pain relief. Combination therapies also played a role. When PDE5 inhibitors are paired with medications like tamsulosin or sulfasalazine, there was broader improvement across urinary symptoms. Now let's talk objective measures. Metrics like maximum urinary flow rate, or Qmax, and post-void residual did improve, but not as consistently. And of course, there are limitations. This review includes only 5 studies with varied patient populations and treatment approaches. So while the results are promising, they're definitely not definitive. So what does this mean for practice? PDE5 inhibitors, especially tadalafil, appear to be effective, well tolerated, and with men with LUTS not related to BPH, and there's the key, they may be particularly useful when these patients also have erectile dysfunction or pelvic pain syndromes. This opens the door to a broader, more personalized approach to managing male urinary symptoms. Instead of focusing solely on the prostate, we may want to think more holistically about bladder function, vascular health, and patient quality of life. So they help your erections, they can help cover your urge and problems with LUTS, they can help your heart. Miracle pill. Well, for more evidence-based urologic care, make sure you subscribe to the channel. Now, coming tomorrow on UroNurse News, what if your frustration with chatbots could actually make you $100 an hour? That new trend is turning heads. Companies are now paying people to bully AI systems, all in the name of making them smarter. But what does this really mean for healthcare, patient safety, and the future of digital communication? Is this innovation or a warning sign? Can AI truly handle human emotion? And should we trust it in clinical settings? Well, join me tomorrow and we'll learn more.
UroNurse News every weekday at 9 a.m. Central Time.